Stephanie from WorkSafe Tasmania, and I'll be your moderator. In recognition of the deep history and culture of this island, we acknowledge Tasmanian Aboriginal people, the original and continuing custodians of the land, sea and sky. We acknowledge and pay our respects to all Tasmanian Aboriginal people, all of whom have survived invasion and dispossession and continue to maintain their identity, culture and Aboriginal rights. Please take a moment to read the following slide about information received today. Please use the chat window on your control panel to type any comments or questions for today's presenter. Those questions will be addressed throughout today's webinar. Only presenter and moderator webcams will be used, and today's webinar is also being recorded. It is now my pleasure to introduce your presenter today from Menzies Institute for Medical Research and University of Tasmania, Kelly Broughton. Kelly is a project officer at the Menzies Institute for Medical Research, working on the Working Well project. Kelly is completing her doctoral degree and is an expert in work health and safety. Her research involves studying physical and mental injuries or illnesses, focusing on workplace conditions, return to work experiences and outcomes. Kelly's doctoral research examined the experiences of workers returning to work after injuries, exploring factors that influence these experiences. She has also worked on projects to improve work wellbeing, enhance return to work resources, and understand the impact of the workers' compensation system on injured or ill workers, as well as regulating psychosocial hazards. And we welcome Kelly today.
Hi, everyone, and thank you, Stephanie, for the introduction. As Stephanie said, my name is Kelly Broughton, and I'm the Working Well Project Officer from Menzies Institute for Medical Research. And I work alongside Professor Angela Martin and Dr. Larissa Bartlett. So today I'm here to spread the word about the Working Well study. That will include me talking about what the Working Well study is, what the aims for the Working Well study are, as well as how people can help. So why Working Well? We know that work and our occupation is an important social determinant of both physical and mental health. Fun fact, we spend on average 1/3 of our lifetime working. So to break that down into hours, that's 90,000 hours working. I'm not saying that for you to think too much about that, as I can already feel internal groans about the reminder of how long we have to work. But I say that as we need to know how to best improve our workplace to make those 90,000 hours less groan-worthy and a healthier place to be. Let's face it, we'd much rather be spending 90,000 hours in a place that promotes positive mental health rather than the alternative. So Angela Martin and one of her PhD candidates, Adam Nebbs, published a white paper on realising the opportunity of prevention and promotion strategies for a mentally healthy and productive Tasmanian workforce. Now, this is a paper that discusses an array of evidence on the protection and the promotion of mental health in the context of work. So this includes discussion on the changing of work, health and safety policies, and the different landscapes, and guide action by Tasmanian employers and policymakers. Now, this paper is really easy to read and it has a lot of really digestible information. I know that some papers that are published can be very academic heavy with the jargon, but this is not one of those papers. There are some really great resources recommended and some really useful information on the role of leaders and line managers, as well as the role of government and industry. So I highly recommend reading that. Now, I tested the QR code this morning to find that, of course, on the day that I present, the QR code was not working. So I will send a link to Stephanie to circulate to those who attended following the presentation. In Tasmania, we've had employers and governments acting on the knowledge of the impact that work has on people and their wellbeing. So there's been recent developments in policy, such as recent regulations regarding the management of psychosocial hazards, the Respect at Work positive duty, which is now a new positive duty on employers to prevent workplace sexual harassment, sex discrimination, and victimisation. And we also have the right to disconnect policy. So we can see some really positive changes starting to shift focus to building mentally healthy workplaces. WorkSafe Tasmania and the Department of Health are building a workplace mental health framework for Tasmania. And this is going to guide employers towards best practice. And that's where we come in. Menzies has been contracted to deliver a research-based activity, the Working Well study, as well as the Working Well blueprint. Our Working Well study aims to create a baseline data set or a diagnostic profile with the purpose of improving workplace mental health practice and business capabilities. So this will tell us where we are at the beginning of hopefully what will be a continuous process of reform. Our Working Well blueprint aims to match any deficits or challenges that Tasmanians face with guidance and evidence-informed interventions to help employers build their capabilities. But why? Let's have a look at Tasmania as a whole. We're an island state with a population of 500,000. We have a higher prevalence of mental health conditions, with Tasmania having the highest rate of long-term mental health conditions in the country. Now, looking further into statistics of this, and I can tell you that during 2020 and 2022, 52.9% of people within Tasmania had a lifetime mental disorder and 19.8% had a 12-month mental disorder. Tasmania also has a lower socioeconomic status compared to mainland Australia. And then we can couple that with the fact of the cost of living crisis that we're all facing. Tasmania also has lower levels of literacy and education, and we also have limited strategic action on workplace mental health. So looking at all those factors and then considering the 90,000 hours that we spend at work, we need to find a way to improve those statistics. So our Working Well study is replicating a study that's been conducted by Safe Work New South Wales. They started in 2017 and they've continued every 3 years since. Our survey will be a statewide benchmarking assessment of the workplace mental health capability and practices. Our survey will look at mental health in relation to leadership, culture, policies and practices. So whether an organisation has a strategy or a vision, whether there's mental health policies, whether they're monitored or updated, risk management. So whether there's any discussion of psychosocial risks in the workplace, discussions on work design, whether there's any consultation with workers. Not only that, whether there's any reports or communication about those consultation processes. Education and training. So is there training and education around mental health, and is it targeted? And support services. Is there access to support if it's needed? Are those services discussed? Or is there quality control over those services? Or even are those services fitting the needs of the employees? Our survey is aiming for a representative sample of small, medium and large employers in the government, private and non-for-profit sectors across all industries and regions. We're interviewing employers and employees with online surveys and telephone interviews. Here are some key facts that our project team wants everyone to know. Firstly, this is the largest ever workplace study done in Tasmania, ever. So we need some help. The study is voluntary and confidential. So if you decide that you wish to withdraw after you've participated, you're free to do so. And this won't impact any relationship that you may have with Menzies. Menzies holds the data of this study. We adhere to strict research ethics procedures. So this means that only the research team have access to your data and you're anonymous. And we aim to recruit more than 10,000 workers and more than 600 organisations. So spreading the word about this research is critical for us to reshape the future of Tasmanian workplaces. We really do need your help. So where do we even begin? Here is how we plan to do so. You'll see here that we have two colours. We have purple and orange. The purple shows the pathway for our employers and the orange shows the pathway for our employees and workers. I'll talk to you about both pathways as they're slightly different depending on what path is taken. So I'll start with the employers. We have a team of research assistants that are primed and ready to talk to organisations. We will start by randomly selecting organisations to participate. Now, we've spent a considerable amount of time building a list of Tasmanian organisations, all from public databases, that have been allocated into random generators. So if you're chosen, one of our RAs will reach out and arrange a time for an interview. You can choose to do it over the phone with one of our research assistants, or you can choose to do it online if it's more convenient. The employer survey has 72 questions. And as you can see by the flow chart, the RAs will take you through a range of different questions. Now, if you wish to, our research assistants can email you with some details of the type of information that you'll need to know to answer the questions, as well as the layout of the scales that we're using in some of our questions for your convenience to refer to during the interview. For employees, the process is a little bit different. So we have a website that's listed at the end of the presentation for you to enter our survey. From there, you'll see a video of me explaining the process. You will then provide your consent and work through the questions before submitting. For our employees, you can choose to go into the draw to win one of 5 $200 FPOS vouchers. We also have social media tiles that are available for you to share that you've completed your survey and ask others if they've completed theirs. This is to help us, again, spread the word and get as many responses as possible. Remember, we're aiming for over 10,000 workers, so we need as much help as we can get. During the survey, we'll ask what you think about the mental health maturity levels of your organisation. So these are the terms that we'll often refer to, or we may refer to them as stars. We may refer to these as 1 to 5 stars to help you during the survey and remember what each maturity level means. So you'll see we have integrated and sustained, or what would be 5 stars. This would be having a mental health policy that's embedded across the business with tailored and continuous improvements. Effective action, or 4 stars, which would be targeted and proactive action on mental health. Limited action, or 3 stars, which would be only focusing on mental health when an incident occurs. Intention, or 2 stars, which is having some focus on mental health. And basic awareness, or 1 star, which is having little or no focus on mental health. So following the completion of the survey and all of our analysis of our 10,000 plus survey respondents, this is the type of data that we'll be able to gain from the study. So this is some of the data that SafeWork New South Wales published, and it shows you how we'll be able to report the different things. We'll be able to report the average score or the maturity level among the regions of Tasmania, with percentages of how many organisations fall within each level. We'll be able to give industry breakdowns and see what's being done very well or what could be improved upon. And all of this type of information is what's going to help us with forming our Working Well blueprint. Now, the Department of Health Suicide Prevention Strategy requires guidance on evidence-informed workplace interventions. The strategy will be aligned to the first iteration of the Working Well Tasmania study. Now, I say first iteration because we're hoping that we can continue in the years to come and do the study again to see how Tasmania is tracking and whether we're improving. Our blueprint will be a synthesis of the evidence and infographics that will help guide workplace mental health interventions and considerations for employers, workers, and other stakeholders. Our blueprint will aim to match those areas that need improvement to intervention strategies that we know have been shown to increase capability within the area that's being targeted. So our data will be able to say what areas need improvement, with what recommendations, research-based interventions and practices can be done that will lead to improvement. Now, the aim of the Working Well study is to provide a holistic approach that will lead to improvement, not just to show how good or bad Tasmania is doing at promoting mentally healthy workplaces. So how do we know it will work? Here's an infographic on how SafeWork New South Wales has improved since they started the study in 2017. Now, this demonstrates that there's improvement following the study's first iteration, so from 2017 to 2020. And you can see that there's been significant improvement, with a lot more organisations having those processes in place and taking those actions to create mentally healthy workplaces. So with our study and with our blueprint, in 3 years, we could be back here presenting something similar or perhaps even better outcomes than those that I'm showing you right now. But before we do that, we need the data to begin with. So how much data do we need exactly? Well, I did say it was Tasmania's largest ever workplace study. So to break it down for you, we have over 264,000 Tasmanians in paid employment. Our study has a non-random sample, so we have people choosing to opt into our online survey. There's also the possibility of a phone interview if requested. We want 5% of the total of Tasmanian working adults, so we're looking at approximately 13,200 workers. With our employer survey, we have 42,565 registered organisations in Tasmania. Most of those are sole traders and have less than 4 employees. Now, unfortunately, these businesses aren't eligible for this study, but that's not to say that we're not mulling over how to create a similar study or a similar version for smaller Tasmanian businesses. 80% of organisations are small, having 4 to 19 employees. 19% are medium with 20 to 199 employees, and 1% are large with 200 plus employees. We've combined the medium and large businesses for anonymity purposes. Otherwise, it might lead to identifying particular organisations within certain sectors. We assume that we will have a 50% non-response in our sampling frame, which means 1,242 organisations, stratified by industry and size. Again, these surveys will be done via the phone, or they can elect to be done online. So we're after 10% of 6,240 organisations, which is 624 organisations to complete the survey. It's a lot of data. So how can you help? You can go to our website. Our website will explain a lot more about the study. It will also provide you with all the advertising material that you could possibly need and links to our surveys. You could help out by amplifying our social media posts, share them, repost them, like them, comment on them. You could tell your friends, you could tell your family, you could tell your dog. I mean, they can't fill them out, but you could tell them anyway. My point is, we just need you to tell everyone about it. Ideally, you could help by promoting participation through your workforce, so through newsletters, posters, and events. Please feel free to contact us if you're interested in helping. As I said, we've got advertising material that you can download and print. We're also happy to put something together in writing for your newsletter, or attend any meetings you may have to spread the word about our research. Honestly, any member of our research team loves promoting workplace mental health, and we'd love to get as much participation as possible. So we're happy to help out in any way that we can. If approached by one of our team members or a research assistant calls you to participate, please understand that they're not telemarketers or scammers. We understand what getting random phone calls is like, and it tends to be happening more and more, scam calls, but it's possible that it's one of our research assistants. If your business is not randomly selected but is willing to help promote the study, please fill out the expression of interest on our website. It takes many hands to make light work, and we need all the help we can get to get the data that we need to help reshape our future. Before I wrap up our presentation, and I'm sorry, Stephanie, we might be finishing a little bit early, I want to provide you with the link to the website, and I want to show you the other wonderful people behind the research. Our team has Dr. Larissa Bartlett, Professor Angela Martin, Professor Tony Lee-Montagna, and me, Kelly Broughton. As I said, we also have an amazing team of research assistants who are ready and waiting to make all of our phone calls to you. They're all really excited to be involved and to talk to you about your organisations. Again, that QR code has expired or is not working, so I can provide all this information as well as the downloadable advertisements to Stephanie after this presentation. But other than that, please help. We need everyone's data to be able to reshape how Tasmania is working, to make sure that we're working well and to build mentally healthy workplaces. Thank you so much for attending this webinar, and I'll now hand back over to Stephanie for any questions.
Thank you, Kelly, for your presentation today. So our presenter today is Kelly Broughton from the Menzies Institute for Medical Research and University of Tasmania. And Kelly's webinar has been We Need the Data, Is Tasmania Working Well? And the presentation has been about the Working Well study. So there's information on your screen to allow you to find out more about the Working Well study or to how to get involved. But if anyone does have any specific questions for Kelly, please use the chat window to type those and submit those questions today. Today's webinar has also been recorded, so please head to WorkSafe Tasmania's YouTube page to rewatch and share today's recording, as well as to watch any other webinars that we have delivered already during WorkSafe Tasmania month. No questions are coming through, Kelly, but as you mentioned, we'll definitely share the QR code with everyone who attended today's webinar, so please look out for that email in your inbox. So, to wrap up today's webinar, again, thank you to our presenter, Kelly Broughton from Menzies Institute for Medical Research, University of Tasmania, for her webinar today, We Need the Data, Is Tasmania Working Well? Today's webinar has been brought to you as part of WorkSafe Tasmania Month. WorkSafe Month is an initiative that is funded by the WorkCover Board Tasmania. Please head to WorkSafe Tasmania's website to please find out about other webinars and in-person events that we are running throughout the month of October. Today's webinar has also been recorded. Please head to WorkSafe Tasmania's YouTube page to rewatch today's webinar and also other webinars that we have also delivered. Thank you again to our presenter, Kelly Broughton, and thank you for everyone for attending, and please have a safe and healthy rest of the working day. Thanks.